Diagnostics urinary system. Clean catch urine. Clean the urethral area and void a small amount, and then void into a sterile specimen cup. If the patient is menstruating, a fresh tampon can be used to temporarily stop the flow. What does a urinalysis examine? Protein should be 0 to trace amounts. Protein in the urine can be a symptom of kidney stones, inflammation of the kidneys, degenerative kidney disease, or multiple tumors. And some medications may give a false positive reading. An increased number of white blood cells could mean a urinary tract infection or inflammation. Casts are small fibrous objects that are formed when protein and other materials settle in the kidney tubules and collecting ducts. Casts are dislodged by normal urine flow. A large number of them in a urine specimen is a sign of kidney disease. The presence of abnormally high number of ketones, ketonuria, usually results from uncontrolled diabetes mellitus. Ketonuria can also be caused by prolonged diarrhea or vomiting that results in starvation. A high level of glucose and other sugars, glycosuria, is often a symptom of diabetes mellitus. Glycosuria can also be caused by advanced kidney disease, Cushing's syndrome, impaired tubular reabsorption, shock, pheochromocytoma, or cancer of the pancreas. Medications can affect a urinalysis, like cephalosporins, cimetidine, cisplatin, gentamicin, and trimethoprim. The patient should be taught to avoid intense athletic training or heavy physical work before the test because it may result in small amounts of blood in the urine. What does a creatinine clearance testing involve? It approximates the GFR. It's a 24-hour urine and should be on ice or a preservative is added. Once the order is received, the first urine is discarded and the rest is held in a large container. What does a serum creatinine and blood urea nitrogen examine? Creatinine is a breakdown product of creatine, which is an important part of the muscle. Creatinine is removed from the body entirely by the kidneys. A BUN measures the amount of nitrogen in the blood that comes from the waste product urea. Urea is made when the protein is broken down in the body, and urea is made in the liver and passed out of the body in the urine. A BUN to creatinine ratio can help check for problems such as dehydration. You do want to instruct the patient not to eat a lot of meat or other proteins in 24 hours before having a BUN test. A cystogram is where a cystoscope is inserted into the bladder for direct visualization, and then contrast solution is injected through the scope so that the x-rays can be taken. A cystogram is an examination that takes pictures of the bladder and urethra. Cystoscopy is a test that allows the physician to look at the interior lining of the bladder and the urethra. A dye is used to outline the bladder on an x-ray. After the test, burning on urination is common. The urine color, pink tinged, and urine frequency are expected, and a good fluid intake is encouraged after the procedure. The patient is taught to report signs of infection such as frequency, urgency, painful urination, cloudy or bloody urine, or malodorous urine. A cystoscopy turns bad would include an elevated temperature, which means a possible bladder infection, and this is a complication of cystoscopy. Warm sitz bath and analgesic agents and antispasmodic medications may relieve discomfort after the procedure. The patient is taught to increase fluid intake to decrease pain and difficulty voiding and reduce the risk of infection. Laxatives may be ordered after the procedure to prevent constipation and straining, which may then in turn cause urinary tract bleeding. Retrograde Polygram. It's a type of x-ray that allows visualization of the bladder, ureters, and renal pelvis. Generally, it is done during a cystoscopy. The glomerular filtration rate is a test used to check how well the kidneys are working. Remember that creatinine clearance approximates the GFR. The GFR specifically estimates how much blood passes through the filters in the kidney, the glomeruli. So if your creatinine clearance is 120, then the GFR is 120. The nonsteroidal anti-inflammatory medications are nephrotoxic and should be avoided in patients with impaired renal function. Other nephrotoxic medications, vancomycin and gentamicin. Nuclear medicine scans use a gamma camera to take pictures of tissues and organs in the body after a radioactive tracer, radionuclide, or radioisotope is put in the vein and absorbed by the tissue and the organs. A radioactive tracer shows the activity and function of the tissues or organs. A renal scan helps to find abnormalities such as obstruction like kidney stones while evaluating urine and blood flow within the kidney. Dark spots in the picture can mean blockage of vessels, fluid pockets, infection pockets, types of cancer, or scarring. There are two types of kidney scans, a cortical scan and a functional scan. In a cortical scan, the purpose is to evaluate the shape of the kidney. A functional scan measures the amount of time it takes for the tracer to move through the kidney, urine, and bladder. A bladder scan uses a non-invasive portable ultrasound device that provides a virtual 3D image of the bladder and volume of the urine retained within the bladder, or otherwise known as the post-void residual. The ultrasound test measures the amount of urine in the bladder to look for stones, measure the bladder wall thickness, and look at the elevation of the bladder by an enlarged prostate. Retained urine is a reservoir of bacteria and pathogens which can cause urinary tract infections, lead to damage of the renal structure, pain, and urosepsis. Bladder scans are commonly utilized in acute care, long-term care, rehabilitation environments, as well as in physician offices. Without the use of a bladder scanner, urinary retention is assessed by performing an invasive in and out urinary catheterization, which can be uncomfortable and pose a direct risk of introducing more pathogens into the bladder, increasing a patient's risk of infection. There are two ways then to assess the post-void residual: a non-invasive bladder ultrasound device like a bladder scanner, or straight in and out catheterization. Since a bladder scanner estimates the post-void residual, there are some medications that may cause increased urinary retention, like anticholinergics, antispasmodics, tricyclic antidepressants, antipsychotics, antiparkinsonian drugs, opioids, and anesthetics. Extracorporeal shockwave lithotripsy uses sound waves to break a kidney stone into small pieces that can more easily travel. These shock waves are done if the kidney function is threatened or if the patient has one kidney or a kidney transplant. Flank pain, bruising, and hematuria are common after lithotripsy. A complication would be a decrease in the urine output. IVP, examination of the kidneys, bladder, and ureters. Make sure you verify consent. It is used to diagnose disorders that affect the urinary tract, such as kidney stones, bladder stones, enlarged prostate, kidney cysts, or urinary tract tumors. The patient may be instructed to take a bowel prep the night before and an enema or suppository the morning of the test. Withhold food for 8 hours. Clear liquids are allowed. Ask the patient if they have an iodine allergy, may want to check the BUN and creatinine, and as the dye is injected, they may feel a transient flushing or burning sensation, along with possible nausea and a metallic taste. Patients with impaired renal function are at risk for decreased renal function after an IVP because the contrast medium used is nephrotoxic. So the safety factor would be the nurse would need to monitor the patient's urinary output. Renal arteriogram is an x-ray of the blood vessels of the kidneys. This is used for patients who have high blood pressure that may be caused by a kidney problem. It is also helpful in patients who may have a kidney artery that is closed or the arteries that are inflamed. The patient will need to lie flat without raising their head or moving their leg for about 4 hours. The patient can eat an hour after the procedure if there are no problems with drinking liquids. They will receive IV fluids to help flush the dye out. Monitor the blood pressure, heart rate, and the groin site frequently. A renal biopsy, also known as a kidney biopsy, is usually done using a long, thin needle put through the flank into the kidney. This is called a percutaneous kidney biopsy, and a tissue sample is taken and sent to the lab. Pressure dressing is applied, and the patient is kept on the affected side for 30 to 60 minutes to put pressure on the biopsy site and decrease the risk for bleeding. Renal ultrasound. This looks for changes in the bladder wall, changes in the kidney site or structure, kidney stones, cysts, and mass. An ultrasound may also be used to assess blood flow to the kidneys. Catheterization. Indications for an indwelling catheter include the presence of a stage 3 or stage 4 pressure ulcer that cannot heal because of continual incontinence, or accurate measurement of urinary output like in critically ill patients. The incidence of catheter-associated UTI significantly increases when nurses review the need for the catheter and suggest the use of alternative non-invasive treatments to manage urinary elimination. If there is resistance to catheter insertion, have the patient take slow, deep breaths while inserting the catheter slowly. If there is resistance in the male, then consider the patient may have an enlarged prostate. May need to then use a Coude catheter, which has a slightly curved end and may be needed to facilitate the insertion. There is a natural resistance as the catheter enters the external sphincter, but do not use force to insert the catheter forward. Ask the patient to bear down as if to void and slowly insert the catheter through the urethral meatus. If resistance to inflation is noted or the patient complains of pain, the balloon may not be entirely within the bladder. Stop the inflation, aspirate the fluid injected in the balloon, and then advance the catheter a little more before reattempting to inflate. Large catheters that are larger than a 16 French can distend the urethra and permanently damage the urethra and bladder neck, as well as cause bladder spasms and leaking around the catheter. So always use the smallest size catheter possible to minimize trauma and promote adequate drainage, and this will decrease the risk for infection. If after you have placed a catheter in a woman and no urine appears, check to see if the catheter is in the vagina. If it's in the wrong place, leave the catheter in the vagina as a landmark, indicating where not to insert, and then insert another catheter into the meatus. Once it's in, then you may remove the first one. Reinserting a catheter that has already been contaminated by vaginal exposure could lead to a urinary tract infection. Ileoconduit diverts urine outside of the body when the bladder is removed. A small urine reservoir is created from a segment of bowel and is placed just under the abdominal wall. Indications for an ileoconduit include surgical removal of the bladder for severe trauma or malignancy, congenital defect of the urinary tract, and neurogenic non-functioning bladder in which other devices to maintain urinary flow are unsatisfactory. Tachycardia may indicate infection, hemorrhage, or hypovolemia, which are all serious complications of this surgery. The urine can contain mucus and is cloudy, and that would be an expectation.